Okay, today what we're going to do is we're going to dissect the back. It's always a good place to start because the muscles are big. It gives us a good idea on how to incise the skin. We're going to use scalpel to do this. There are two sides to the scalpel. One, see it over here, is a large handle. This is a number 4 handle one. This is a smaller 3-handled one. The 3 handles take a smaller blade. In this case it would be a 10 blade with a smooth edge. However, we're going to use for this incision the 4 handle and a 21 blade in order to make the incision. This is the 21 blade here. I always put blades on using hemostats. They help preserve the fingers. There it is. And I also take it off using a hemostat, coming in this direction. Here we have the blade set. We'll place it carefully down now. And now we want to mark our incision sites. We're going to begin marking at the intergluteal crease, and we're going to mark up the middle of the back. The cadaver is really hard to kind of palpate where you are, so you kind of guesstimate it. And we're going to come back to the neck area, the middle of the neck, up the back of the head, to an area just above the lobes of the ear. And then we're going to make an incision along the side here, on each side, back here. We'll make another one from about C7 vertebrae, the cervical thoracic junction, along the top of the shoulder to the end or the lateral point of the acromion process, and we'll do that bilaterally. And then the last incision will be from our beginning point down at the top of the crease. Will be 2 horizontal incisions on each side toward the hip joint. So that's what we're going to be cutting. I like to begin in the lumbar area because there's a deep fascia here called the thoracolumbar fascia, which is very obvious and very easy to locate. So we'll begin by making our incision to the lower part of the back, following as close as we can to our line. And then we'll separate out the skin to look to see where we are. I'm going to move this to get a better look here at this incision site area. And I'm going to zoom in here so you can see where I'm incising, and you can see the tissue. If we look, you see the yellowish brown tissue here. That's fat, and that's still fat, so we're not quite down to where we want to be. So we carefully, our scalpel, work our way until we see a nice white fibrous sheath. Even using our fingers to help do this, you can feel how tough the skin is attached onto that underlying fascia. And we gradually keep working our way to remove the skin. Now, as we do, you're going to feel some areas that feel like cords, thin pieces of like rope coming up into the skin. Those are cutaneous nerves. We want, if we can, try to preserve some of these so we can get a better look at it. So we're going to continue move the skin. It's easier to do it on one side, then go back and do it on the other side, and fold the skin back as you do. Okay, once we've made our incisions and remove the skin, you get to see the muscles. Again, these are the superficial muscles of the back. This is latissimus dorsi here. Here is our thoracolumbar fascia here. You see we still have some remnants of fat. Now when you take yours off, you probably didn't see it quite this clean. So some extra work has gone into this in order to make sure that we see the muscles. Now, to do this extra cleaning, I like to use a number 10 blade and a pair of forceps called rat tooth because they have pinchers on them. And then we look over the area of the muscle. We kind of lift it up, and I'm going to go in a little closer. This is the trapezius, lower trapezius to be specific, and we still have this tissue on. Again, once you take the skin off, most of your muscles will probably be covered with this type of tissue. And so what we do is we lift the area, and we begin with our scalpel to run along the fibers. Now you want to make sure your scalpel is kept parallel to the muscle, otherwise it'll go in and cut the muscle itself. Now as you lift up, you'll begin to see this white loose connective tissue. It almost forms like a line, and you stay right along that line, and you just continue to remove this connective tissue and fat from over the muscle. It does take time, and it's tedious, but it's also the only way in which you'll be able to designate which is the direction of the muscle fibers. And you want to clean all this off, and then after that is cleaned off, then we'll begin to start cutting muscles and looking at deeper structures. Here's the latissimus dorsi coming up, and here's the teres major. Notice how the latissimus dorsi kind of dives under the teres major. Both of these muscles attach in a similar place. Okay, here's the humerus, there's the head, and down here you can see a groove. Right there. Here is the lesser tubercle, the greater tubercle, and there is the intertubercular or bicipital grooves. Well, there are two ridges on this group. One associated with the lesser, the other one associated with the greater. Now, if we move this into position, the lesser side becomes medial. That is the medial lip of the bicipital groove, and there is where the teres major attaches. Well, in the floor of this groove is where the latissimus dorsi attaches. And on the lateral lip, continuous with the greater, is going to be the attachment for the pectoralis major. All three of these muscles pull on the humerus in this direction, causing glenohumeral adduction. But at the same time, because of their location here anteriorly, these muscles also are going to produce an internal rotation. So the three muscles attaching onto this groove, the teres major, latissimus dorsi, and the pectoralis major in front, are all adductors and internal rotators. The scapula also has multiple attachments to it for multiple movements. And here again is the trapezius. You know, remember we have three parts: a lower trapezius, a middle trapezius, and an upper trapezius. All three fire independently, and they also can work together. For example, the upper trapezius on both sides, when it is contracting here and here, it is going to cause extension of the head and neck. It's It's going to lift the head and neck, move it backwards. However, if it's on one side, you can notice the fibers are running obliquely. They're running from the midline laterally. So when they contract and pull, the head is going to be turned in the opposite direction. So it's going to turn the head in that direction, this way. Now, when these muscles again on one side just contract, they can also laterally bend the neck in that direction. So the upper trapezius can move the head and the neck in extension, rotation to the opposite side, and lateral bend to the same side. This muscle can also act on the scapula. Remember, it attaches here onto the scapular spine. There's the supraspinous fossa there. There's the infraspinous fossa. And so this muscle will produce elevation here of the scapula. Because it also attaches anterior onto the clavicle, here's the clavicle here, and the upper trapezius attaching onto it, so it is going to cause elevation of the scapula and clavicle. Now, again, if you look at the fibers here in this superior portion of the upper trapezius, they have a tendency to move from front to back. Well, if I elevate the scapula, there is a greater front to back direction to these fibers, and as a result they pull on the clavicle, rotating it posteriorly. Now, in addition to that, we have the scapula can rotate up and it can rotate down, and it's determined by the direction of motion of the glenoid fossa right here. So this is upward rotation and that is downward rotation. Now, upward rotation is produced by the action of three muscles. One is the upper trapezius. The other one is the lower trapezius. The lower trapezius attaches right there, the upper here, and together produce a force couple along with the serratus anterior, which attaches on the undersurface here to produce this kind of rotation. I get this type of motion. Now, underneath the trapezius is the rhomboid major, the rhomboid minor, and the levator scapula. There's the rhomboid major, minor, here, and levator scapula. These three muscles are involved in the downward rotation here. The rhomboids and levator are going to pull this vertebral border in that direction. At the same time, attached here to the coracoid is the pectoralis minor, which pulls down. So the downward pull of the coracoid and this upward retraction-like pull of the rhomboids and levator scapula produces this downward rotation. By themselves, the rhomboids can retract the scapula. By itself, the levator scapula will elevate the scapula. Just as a kind of reminder, there's our latissimus dorsi coming across, attaching onto the inferior part of the scapula, also onto the thoracolumbar fascia, comes across in a superior anterior direction, and then it crosses underneath this muscle here, which is the teres major. Teres major attaches onto the medial lip of the intertrochanteric lip of the intertrochanteric groove, and the latissimus dorsi onto the bottom or the base of the groove itself. Both of them are going to assist in adduction. Both of them are going to be internal rotators. Here is the second of the superficial muscles outside of the latissimus dorsi. There's the trapezius, again, an inferior portion, a middle portion, and a upper trapezius. We talked earlier, remember that this muscle has multiple functions. The upper trapezius here attaches to the neck, also moves the head and the neck, but it also attaches onto the scapula, so it can also elevate the scapula. And again, I don't know if you can see it, but on your bodies, notice that these superior most fibers here have kind of an anterior-posterior arrangement to that, because one of their functions is to posterior rotate the clavicle. The middle fibers are primary retractors or adductors of the scapula. The inferior part is going to be a depressor, but most often it works with the upper trapezius and the serratus anterior to produce upward rotation. Now, what we've done is we've cut through along the vertebral attachment of the upper, middle, and lower trapezius and reflecting them backward. We did this on both sides, and this helps us to see a number of other structures. Here is again the trapezius, and if you look at the trapezius on its undersurface, you'll see an area of fatty tissue right in through here. Okay? Now if you look at that fatty tissue, what you'll find is some arteries right there. There's also a nerve there. That's the spinal accessory nerve. Here is the undersurface of the trapezius we're looking at. There's an artery going to the muscle, and right alongside it is this white cord-like structure right there, and that's spinal accessory nerve, which is the motor innervation to the trapezius. Now the trapezius also has innervation from C3 and C4, but that's proprioceptive and sensory. This is the motor innervation for the trapezius. Now we see another grouping of muscles. These are the other three superficial muscles attaching from the spine onto the area of the scapula. These are the rhomboids. Here's the rhomboid major. Here, big band. Here's the rhomboid minor, much smaller. You see it here, right there coming across. So there's the major, and there's the minor underneath it. This muscle coming off here and heading down deep there is the levator scapula. On this side we see the same thing. There's the rhomboid major. The minor is right there. And then again you'll see fibers that are heading down into the neck here, which are going to be the levator scapula. Here's the spine again here. Now here's the scapular edge here. This muscle here, here, and here is the rhomboid major. This muscle here is much thinner, running this way, and again we see it on this side running over here is the minor. Here and here is the levator scapula. The levator scapula, the rhomboid minor, see here, and the major are all innervated by the dorsal scapular nerve off of the C5 component of the brachial plexus. These muscles are involved in a number of movements. You can see how the rhomboids here are going to tend to be retractors of the scapula. The levator is going to elevate the scapula, as the name implies. When these three muscles, rhomboid major, minor, and levator, work together, along with in front the pectoralis minor, they act in unison to cause a downward rotation of the scapula. Now one last thing here is that when we follow the levator, what we're going to find out is it has usually three heads to it. We're just seeing one of the heads now, but there are actually three heads to this levator scapula. The levator scapula is going to kind of disappear. And remember the trapezius, with this back, had fibers running this way, but now we have a set of fibers kind of running in an opposite direction. So let's move this up again. Here again is upper trapezius here. Reflect that back. There, running right here, is levator scapula. Again, it's going to have three heads to it. We've only got one of the heads. Now notice that there's also this muscle running here. The fibers are running from the spine anterior towards the ear. This muscle is the splenius capitis. It is one of the deep muscles of the neck, and its counterpart, which is right underneath it, here is the splenius cervicis. One of the reasons I'm talking about this now is that the levator scapula inserts where the splenius cervicis attach, so they sit right next to each other. And as we move down in this section, you'll see that a little more closely. We have the rhomboids there. Here's what's left of the trapezius. Now here is the latissimus dorsi muscle here. Now what we've done is we've cut along here and reflected back. When we've done that, we've noticed that there have been these protrusions coming out. See them here, there, on this side. Here's one there, there's one there. These again are those branches of dorsal rami coming to the skin of the back. But also notice that we have a muscle that's running in this direction, underneath the latissimus dorsi. This muscle is the inferior serratus posterior muscle. It's a ventilation muscle, and it's really classified as an intermediate back muscle. Its counterpart is here under the rhomboids, and we're going to have to cut through the rhomboids to see the superior. So now we begin to see it up through here. And again, we see this white band here. I'm going to get a close-up of that. So here's the trapezius on both sides. Here's the trapezius on this side. Here is the rhomboid major, both superficial back muscles. And then on this side, we just reflected the rhomboid major. Now I'm going to take a little bit more here, cut, and look underneath it, and you see that there's another muscle coming across in this direction, and that is going to be right here, the serratus posterior superior. So the serratus posterior superior is lying under the rhomboid. The two is respiratory. It's an intermediate muscle. And here is the, down here below the latissimus dorsi, the serratus posterior inferior. Now, the next group of muscles are the deep muscles. And we can begin to get a hint of these deep muscles running down through here. These are the erector spinae. These tendons you see coming out here are part of the iliocostalis. And so what we're going to need to do now is go deep to all this to see that. Here's latissimus dorsi pulling away. You can see beginning some of the nerves coming into it. These are from the dorsal rami. Here is the inferior serratus posterior, the posterior serratus inferior. Here again, we get a nice view of the lateral branches coming off, and we also get a good view of the attachment site here. This is the thoracolumbar fascia. We go to the other side. Now we'll do the same thing. Here's latissimus dorsi here. We're going to pull away. There's the serratus posterior inferior, and now here is the posterior layer of the thoracolumbar fascia, and again we get to see the lateral cutaneous branches coming off. Here's the upper trapezius. We're going to move out of the way here on each side. Here's the rhomboids. There are the rhomboids moving out of the way, and we'll come back to that area. But right now, here is the erector spinae. You can see it's fascia here. You see some cross banding as we move down here over the sacrum, coming down, as opposed to the long fiber direction here of the muscle itself. We'll get a little closer view of that. There is the erector spinae. There is the spinous processes and the attachments here of the posterior layer of the thoracolumbar fascia. And here's that differentiation. We see these cross bands here over the sacrum, right there. And you can see now the more vertical path of the fibers in the tendon. We see this crossing on both sides. Here are these lateral cutaneous branches of the dorsal ramus of the spinal nerves. Remember that the erector spinae has 3 columns. Here we see the column coming out here most laterally, attaching onto the ribs. This is the iliocostalis. Here in the center is the longissimus. So here's iliocostalis lumborum, longissimus lumborum. And then we have to wait up into here, the thorax area, before we get a good view here of the spinalis. We'll pan off again. Here we've taken off of the serratus posterior, inferior. Here's the serratus posterior superior. But as we follow here the iliocostalis lumborum, we come to another sheet of tissue, connective tissue going crossways. And this sheet is interesting because it goes over the longissimus, but then goes deep here to unwrap or connect to the rib cage over the area of the tendons of the iliocostalis thoracis. Here again, the fascia. We lift it up, we expose. There's the longissimus thoracis, longissimus here, and here is the longissimus cervicis, and here's that fascia. On the other side of this fascia, right through it here, we see the tendons here of the iliocostalis. Same thing on the opposite side. Here we've taken the rhomboids, moved them away. There's the serratus posterior superior, moved away. And again, we have this fascia that's running into the neck, okay, covering the longissimus. There's spinalis here coming up, and then here are the tendons here of the iliocostalis coming up. There's thoracis, and here you can begin to see some of the cervicis. We're going to clean that up a little bit more there. But as we move and follow this tissue, we see that it also stops here. This muscle here is the splenius capitis. That is splenius cervicis right there. So here's longissimus thoracis, longissimus cervicis. There's the splenius cervicis. Here's our fascia there. Here's the longissimus thoracis, longissimus cervicis. There is splenius capitis, underneath splenius cervicis, and then along the spine here, very nice, there is the spinalis.